always get this question asked, how long does a facelift last? The simple answer is that the facelift lasts usually about 8 to 10 years. But here's what I mean by that. If you had a twin sibling and he or she did not have the surgery and you had the surgery, in 8 to 10 years, you will still look 8 to 10 years younger than your sibling who did not have the procedure. So you continue to keep and reap the benefit of the procedure, but you cannot stop the aging process. What that means is that 8 to 10 years from now, you will look a little bit older than today, but you will still look younger than your sibling who did not have the surgery. So the recovery time for a facelift is usually about 7 to 10 days is what I tell my patients. Sutures start coming out on day 4 or 5, and all your sutures will be removed by day 10 or 12. And most patients, you look presentable enough. In fact, you could put makeup on around day 7, so you look very presentable enough to be in public places in 7 to 10 days. We do have pre-op teaching, and we do have things that we use in the OR to minimize the chances of bruising and swelling. And so all these things in combination makes you heal faster. And so most of our patients look presentable enough to be in public places in 7 to 10 days, and you could resume full activity by 3rd week. When we talk about facelift, there are different types of facelifts. So face is divided into thirds, upper, middle, and lower. So depending on which part of your face has aged the most, we do different facelifts. The most common facelift is the lower face and neck lift, and that is to improve your jowls and sagging neck. The endoscopic brow lift is really for the upper part of the facelift to elevate your brow to a more youthful position. And the endoscopic mid facelift really elevates your cheeks, cheek region or the mid-face region. So depending on which part of the face has aged the most, we pick the appropriate facelifts.